Good morning, everyone. Thank you for joining us. We're coming to you from TJC with another Wednesday briefing. I'm gonna give us another minute to let folks into this call, and then we can get started. If you could, please put your name and organization and county you're joining from in the chat, so we can see who we have on the call today. Thanks, everyone, for joining. All right, so we're at time, so we're going to go ahead and get started. Hello, everyone. My name is Jane DeMoby. I'm an attorney at Tennessee Justice Center. And today we have a Wednesday briefing for you that's going to look a little bit different. A lot happened last week regarding the House vote regarding the budget reconciliation bill that we've been talking about over the last few weeks. So I have Gordon and Signey from TJC here to run through what happened last week and what we're looking ahead to. We decided for today's meeting to have today's call to have more of a meeting format rather than a webinar, just to give you all a chance to see one another, chime in with any questions, and have a much more informal discussion about what's happened so far. So if you've had questions and things that you just really wanted clarity on, this is the time to pose those questions to us, and we'll do our best to provide clarification. So in a minute, I'll introduce Gordon and Signey, but just some logistical issues. This is a meeting, like I said, so you have the ability to unmute yourself to ask a question down the line when we open that up. But please keep yourself muted just so everybody can focus on the speakers today. You're welcome to have your camera on if you would like. We would love to see you. We're all in the same room, so you'll see all three of us at the same time. I will be monitoring the chat, so if you have any questions and you don't want to come off mute, you can just put your questions in the chat, and I'll kind of flag it to Gordon and Signey to respond. And just, yeah, we look forward to hearing your thoughts on the updates we'll share today and answering any questions you might have. So I'll be focused on the Zoom page and kind of organizing everything. But at this point, I will turn it over to Gordon. So really briefly, Gordon is a staff attorney at TJC and a co-founder of our organization, and he's an expert on health policy. He spent the last couple of weeks providing you all just-in-time updates on what's going on at the federal level and how that'll impact Tennessee. So he'll just do a little bit more of that today. And Signey, who's our Senior Director of Nutrition Advocacy here at TJC, will chime in on how the budget reconciliation bill that has passed will affect SNAP and the broader nutrition programs. So you can expect them to kind of bounce off of one another. I'll chime in at some points, and we'll give you the information we have. Today's meeting might be shorter than our prior meetings because it's going to be based on questions from you all. So yeah, just feel free to chime in whenever you're ready. With that said, I'm going to turn it over to Gordon.
Okay.
Gordon, what you got for us?
Thank you, Jane. And we're sort of making a virtue of necessity. One reason why we changed the format and why I need to give a disclaimer about our ability to answer your questions is there's still a lot of unknowns about what passed last week. Just to recap for people who may be new to these briefings, the House and Senate are using a special legislative process called budget reconciliation, which fast tracks legislation that relates to the budget, either spending or revenue raising, in this case, tax breaks and budget cuts, all bundle into a bill that is exempt from filibustering. So it only takes a simple majority in the Senate, unlike most legislation, and it can only be subject to very limited debate on the floor and amendments. So it's got the skids are more or less greased for passage of a bill like this. But as we're going to explain, it's going to be a very white knuckle sort of cliffhanger of a process before it becomes law. And our purpose, at least here at TJC, and we hope you will join us in this, is to keep it from becoming law, because, as we will explain, it is so absolutely devastating to particularly marginalized Americans and Tennesseans, but really the entire country is going to feel the ill effects of this for reasons that we will explain. So the hurdles that have to be passed for it to be passed into law is it has to clear the House. Then it goes to the Senate, and that's where it's headed right now. If they pass it and it differs from what's in the House, then it goes to goes back to the House. They meet, the House and the Senate meet, and they try to come up with a compromise bill that will pass both houses, and then it goes to the president. Of course, if the Senate adopts the House version, it just goes straight to the president. That is unlikely, and it's certainly something that we don't want to see happen. The timetable is very tight. This is expected to go to the floor of the Senate June 23rd. That's a little bit over 3 weeks, basically. And although that's very tight and there's a lot of conflict within the Senate and with the House about all of this, it has to be said, that's the deadline that was set back at the beginning of the year, and they are on track to meet that deadline. They set a deadline for themselves of moving it out of the House before Memorial Day, and that's just what they did. Even though it took committees meeting starting at 1 a.m. and, sending it to the floor for a vote, 1,000-page bill that people hadn't seen, they still voted on it. So that's the kind of momentum this has behind it, and the challenge that we face. The bill, just to give you an update, as I said, it was rushed through the House, basically unread, except for the Rules Committee people that amended it the last minute. A week ago, we described the House bill that was teed up to go to the Rules Committee. Material changes were made there, and one reason why we've changed the format for this meeting is we still don't know important details about that bill. We know the big ticket items, and we're going to talk about those here. The basic structure is the same. The most destructive features are still there, and in fact have been made worse. But the full extent of the changes can't be understood until the experts that we rely on go through and look at the interactions, because as I'll explain about the impact on Medicare, if you look at the changes by themselves, you don't have the complete picture, because when you put them together, their interactions, they compound each other. So we don't know that. And the Congressional Budget Office, the nonpartisan referee agency that works for Congress that, quote, scores the bill, which means they do the fiscal estimates about how much taxes will be raised or forgiven, how much expenditures will be authorized or revoked. They haven't completed the scoring yet. So there are these unknowns. The big picture, though, is something we can talk about today, which is, as I said, it's gotten worse. But it was a very closely fought fight. It passed the House by a single vote. When it goes to the Senate, there is a 53 to 47 split with the Republican majority, as there was in the House. What that means is that if more than 4 Republicans vote against it, it goes down. And I say 4 because if there's a tie, 3 Republican senators defect, and there's a tie, which makes it 50-50, the vice president can break that tie. So it gives the majority another vote, basically. So 4 votes. Right now, there are 3 senators who, for different reasons, have expressed strong misgivings. So this is really a cliffhanger. And our job is to try to resolve that drama in favor of the American people and against the forces that are driving the bill right now. Let me just talk a little bit about the political dynamics, and then we'll move into what happened in terms of the substance, and then open it up to questions.
And Gordon, before we get further, can you just remind us what's the title of this bill?
The title is One Big Beautiful Bill, which is a quote of President Trump. He said that he wanted just one big beautiful bill to encompass his entire domestic agenda. And that's what makes this bill sort of the dramatic confrontation that it is, because it is carrying a whole lot of freight that normally would be broken up into other bills. But using the budget reconciliation process, again, they can avoid a filibuster. So it includes everything from increases in defense spending, a rollback of clean air standards, a repeal of some of the alternative energy initiatives that were passed in the Biden administration. It's got a whole raft of things. And the significance of that is that when you have as close a margins as you do, and it covers a lot of different subjects, one thing for sure, the lobbyists burrow into it and get special goodies put in for their interest. And that's why I say we don't really know what the bill did in its totality yet, and won't know because it was voted on without people really understanding all those details. That also means that you can get individual members that get real invested in supporting or opposing something that might not have anything to do with our issues, but can generate either a pro vote or against vote that affects the whole thing, including our issues. The basic divide is between and this is true in the Senate as well in the House, is between the hard right members of the Republican caucus that have one or two, maybe both agendas. One, they don't like domestic safety net programs and they want to cut them. But they also, some of them are budget hawks who are concerned about the deficit. And I have to say, not without reason. And they don't want to see the deficits add up. So they are against it because they think it doesn't cut domestic programs enough, and they don't like it adding to the deficit, although they don't mind adding to the deficit, many of them, if it means tax breaks. On the other end of the spectrum, you have two or three more moderate members who have said they are concerned about the existing cuts that came out of the House to the domestic safety net programs, particularly Medicaid. So the more people on one end of that seesaw want cuts, the more the people on the other end are saying you're cutting too much, and vice versa, you're not cutting enough. So that's the needle that has to be threaded in the Senate. Let me just quickly talk about a couple of things that were done on Medicaid. And the big picture for those who may be tuning in for the first time is this cuts $330 billion at least out of Medicaid. And that's, I say at least because that's based on Congressional Budget Office scores that were done on the bill before it got amended last week and passed in the House. So that may be well north of that. We know that, again, according to CBO scorings on the less aggressive bill, it would cost ultimately 13 million Americans their health coverage, including 250,000 Tennesseans. So that's the big picture. There are a couple of things that are particularly noteworthy that I'll mention here. One is that it imposes work requirements, so that in order, if you're an adult without children, you would have to work at least 80 hours a month or be engaged in, quote, community engagement, 80 hours a month in order to qualify for continued health coverage. And in fact, if you're a new applicant, you would have to show that you already had worked in the past, met that requirement. There is a move afoot to make those more stringent. That was initially, when we talked last week, it was going to take effect in January 2029 initially, after the next presidential election. But the budget hawks said that doesn't save enough money. We want you to move that up. So it got moved up to December. 2026. If you're wondering why would they pick December 2026, it's because that's after November 2026, which is the midterm elections. So that the idea is that they wanted to capture as much savings as they could from cutting people off the program, but they didn't want those cuts to be felt before the midterm elections, when all members of the House and a third of senators are up for re-election. So they moved that up, but importantly, they also gave individual states the option of moving it up even more quickly. And as we've discussed on previous briefings, Tennessee has an application that's been pending since 2018 to the Federal Centers for Medicare and Medicaid Services, or CMS, which is the Medicaid agency at the federal level, saying we want to impose work requirements. Federal courts had ruled those unlawful under the current law, and that's never been acted on. Wasn't rejected, it's just sitting there. So if this law passes, it would immediately make it possible for CMS to approve that waiver, which, by the way, is much more draconian, much more stringent than at least the version of the House bill before it got amended. We're not sure what the work requirements are going to be now at the federal level, but certainly it opens the door and could speed up work requirements coming to this state soon. The one good news on that, which is the flip side of the bad news, is work requirements aren't really, it's better to describe them as work reporting requirements, because we know that the great majority of TennCare adults who don't have caregiving responsibilities work. They're low income or just above the poverty level. They need to work. They want to work. They do work. The hang up and where CBO says the money will be made on work requirements is people being unable to navigate the paperwork and to get their employers to document their hours and their wages and to go through all of that stuff. We know from experience in a couple of other states that that is a surefire formula for tangling people up and cutting them off, even though they are working. So that's the downside. The upside is that the state can't just throw a switch and start doing work requirements. There's a lot of infrastructure to start reprogramming the computers and setting up the procedures to collect that data. Even if they do that right, we know it will trip up a lot of people, but there is some lag time. So that's the big development bubbling over on the Medicaid side. I just want to mention one other thing, and that is Medicare. The president and the leadership in the Congress has promised that this would not affect Medicare recipients. But I mentioned earlier that you don't really know the full impact of the bill until the analysts go through and see how what you've done in one part of the federal expenditures may have ripple effects somewhere else. Good example of that is for low-income Medicare beneficiaries, there's what's called the Low-Income Subsidy, or LIS program, which provides prescription drug assistance. How do you qualify for that? By being eligible for Medicaid. So when they cut Medicaid for people who also have Medicare, those folks are going to lose their access to affordable prescription drugs through the LIS program. And CBO projects that 1.4 million Medicare beneficiaries, keep in mind, promise, Medicare people will not be affected, but in fact, under the bill that just passed, the House, 1.4 million Medicare beneficiaries will lose their access to affordable prescription drugs. And a study in the New England Journal of Medicine that just came out estimated that based on the lack of access to prescription drugs, we could expect over 18,000 additional deaths among Medicare beneficiaries annually. So that's just a small, tiny footnote in this massive, big bill. Whether it's beautiful or not is a matter of personal taste, but it is certainly big. It is certainly impactful. And at this point, I'm going to turn it over to Sydney to talk about any highlights you think particularly noteworthy before you open it up to questions.
Yeah, and I just wanted to know, there are a couple questions in the chat. I'm taking note of them, and once Sydney presents her portion, we'll kind of start discussing But so thanks everyone for putting your questions in the chat.
Hi, everybody. Thanks for being here today. I wanted to just give a big picture of what happened on the SNAP front on food assistance. So the cuts to SNAP are all there, and in fact, bigger than what was initially reported a few weeks back when we first started talking about this. So for SNAP, it's closer to 300 billion in cuts. This bill, the House bill, will take food away from families. It will raise costs on millions of low middle income families. It takes food away from children. It could impact over 2 million children across the country. On the Tennessee front, it'll impact children here. One of the big things that came through in the last couple weeks was the shift to states, the cost shift to states. So right now in the House proposal that went through, the state will be on the hook for funding the benefit, part of the benefit portion that families receive. Right now, that comes all from the federal government. But that will shift to the states underneath the House bill, which will be a major cost to the state. And so there are lots of questions, a lot of questions during those hearings that happened late at night about how this is actually going to work. How will the state of Tennessee be able to afford this? How will all of our states be able to afford this cost? The big fear there is they won't be able to afford it, and we'll have to find ways to determine who gets benefits and who does not. So that's an area where we would see major cuts that aren't necessarily written into this. The other thing that we've mentioned in past calls that went through with this past House bill is targeting immigrant families. There's a very narrow amount of immigrant families who are eligible for SNAP, and those are the immigrant families who are asylees or refugees or are victims of trafficking. In the past, we have always had bipartisan support that those families are eligible for benefits. This would cut them from that. This will deepen poverty across our state, and beyond the immediate impact to our lowest income families and individuals. It will have effects that reverberate across the community. So it will impact our grocers, local businesses, farmers. It'll have major implications beyond just the families that we serve directly and that receive the benefits directly. So that's the big picture. The one thing that I did want to shift to and say, I want to say that everyone on this call and folks who have just tuned in or have received our emails and have acted, your calls, your outreach, your education, your advocacy really did make a real and meaningful difference. It might not feel like it because this bill passed through, but it was, as Gordon mentioned, it was a very closely fought fight. They barely eked this through. And so we're hoping that you all have the stamina to keep going with us, because we can do it. And I think we need to continue the fight the way it is. The next steps are, and like Gordon said, that we're getting information. We'll have more for folks probably by the end of this week. If you happen to have calls on the books, you can share the big picture with them. You can say, I do not like the House bill. I do not want cuts to SNAP, to Medicaid. Like the Senate needs to hear that. If you have the stamina to call now and again later, do that too. But we will be back in touch soon with more details. But I think those are kind of the main things that I wanted to lift up from the past week since we met with you all last.
Let me just add, the elephant in the room, no pun intended, is, I'm sure some people on this call are thinking, but our Republican senators are not going to be responsive. And again, as it was the case in the House, where our 8 Republican members of the Tennessee delegation all voted in lockstep in favor of the bill, and we always knew that they would. Understand that what's going on right now behind closed doors and will continue for the next 3 weeks is this delicate effort by the Senate Majority Leader, John Thune, and the committee chairs to work out all of these disputes in a way that they can thread the needle to get this thing through with the votes compiled from the people on either end of the spectrum within the Republican caucus. And the speaker will be polling our senators along with the other senators, and there's only 52 other ones beside the speaker, the majority leader himself. So every one of those is potent. He'll be polling them to say, what are you hearing? What do you need? And they need to be passing through the message. We're getting bombarded. It is really creating a backlash. Now, he knows they're going to vote for it, and they certainly intend to vote for it, but that will inform the decisions that have to be made about how they make this sausage going forward. So I know it can seem like, what's the point of calling people who are clearly committed to voting for this? But it does, in fact, matter.
Thanks, y'all. So I just wanted to mention, I don't think I said this at the top, but we're going to send a follow-up after this this call, like we always do, and it'll outline some of the what we think are the most concerning parts of the bill related to Medicaid and SNAP, so you all can kind of review that on your own time. Like I said earlier, this is more so a discussion, but there's a lot to take in. So if you're kind of struggling to keep up, don't worry. We'll outline a lot of these priorities so that hopefully you all have a chance to review them later on.
Jane, real quick, I didn't say this, but Gordon had mentioned the work requirements on the Medicaid side. On SNAP, work requirements already exist for individuals without families. But the plan under the House bill is to make those much stricter, and it would now require individuals with children over age 7 to adhere to work requirements, and already work requirements do not work for all the reasons that Gordon lifted up. But for SNAP 2, there's research out there that talks about how it doesn't help to increase people finding jobs or becoming employed. And in fact, there's research that shows that it knocks people off the programs, and it really does make it more difficult for people to find work or increase hours or do what they need to do to be able to join the workforce.
One of the things, just to follow on that, one of the things that would make, again, just to compound the paperwork issue, the federal statute, and again, the bill, and again, it's in flux. We don't know what it's going to ultimately provide, but right now, if you already meet the work requirements for SNAP, as it would be amended, then you're deemed to be already meeting the Medicaid requirement. So you wouldn't have to report 2 places. But the problem there, of course, is that it is about the reporting. And what that means is it would be dumb for Tennessee to impose the work requirements on TennCare. It makes no sense because we're not a Medicaid expansion state, we cover so few people that would not already be covered by the SNAP work requirements. It would just be doubling up.
Mm-hmm.
The problem, though, is, again, it's not so much that people are not working, it's that they can't get recognized as meeting the requirements. So you have to look at the interplay between all these different provisions, and the more you look at them, not just in isolation, but in combination with everything else, you realize there's this cumulative effect that is terribly oppressive and is creating the largest transfer of income in the history of this country, according to CBO, from lower income, people in the lower half of the income spectrum to people in the top 1%. And I thought it was particularly ironic to see that Elon Musk, the richest man in the world, was on record this morning saying that he is against the bill because it doesn't cut enough from the benefits programs.
So thanks, Gordon. So are we ready for some questions? We have
Yes.
just a few in the chat. So the first question, I'm not sure if we can get into this too much, but someone's asking if we can explain the section about the Justice Department.
I
Yeah.
can't, I don't know what, I'm sorry.
Yeah,
I don't know
okay.
what the provision is about the Justice Department. Like
Yeah.
I say, it's a big bill.
Yeah,
Beautiful or not, it is definitely a big bill.
we're digging into the Medicaid and SNAP portion. Another question is, are there exceptions to the work requirement rules? For example, people have varying degrees of disabilities. And this would be in Tennessee.
Yeah, the Tennessee Medicaid waiver application is absolutely draconian. I mean, it just says if you are not a caregiver if you're between 18 and 65 and you're not caring for a child under 6, then you must meet the work requirements if you're able-bodied. Now, that probably would be construed as exempting people, for example, who are getting Social Security disability. But the problem is that the people who are, first, 2 problems. The state has to have the computer systems to recognize that. And we know from our litigation with our lawsuit against TennCare that we won last year, there were thousands of people who were found disabled by Social Security, that information was either not reaching the state or the state was not acting on it. So there's that. The other problem, which is a much bigger problem, is that there are many, many people with disabilities that make it impossible for them to get work or to get reliable full-time work that don't qualify for Social Security. And by the way, as you probably are aware, DOGE, Elon Musk, ill-named Department of Government Efficiency, has engineered the closing of Social Security offices and the layoff of many Social Security employees. Those are the people who make the findings of disability. Disability determinations are already taking, in many cases, as much as 2 or 3 years. So you can be at death's door, unable to work, desperately in need of TennCare, and not be classified as disabled legally. So those are the issues. The good news is the law says that there are exemptions for people with disabilities, but the way that gets applied, both in terms of definition and logistics, are very problematic.
Just a quick follow-up question from Christine Davenport asking if you can define caregiver. They say, I have clients who do not have legal custody but care for minor relatives. They have nothing on paper, but they are a full-time caregiver.
Well, in terms of the spirit of both the TennCare waiver application and this statute, to put it crudely, those folks are of the creek.
Not the most inspiring, but that's the
No,
truth.
it's not
That's
at
the
all
truth.
inspiring. It just emphasizes the point
Yeah.
that we are facing a desperate contest over the next 3 to 4 weeks.
Yeah.
Hopefully it will go on longer. The longer it goes on, the more opportunity to make the public aware of it. We know that SNAP and Medicaid are popular, something like 84%, according to the latest Vanderbilt poll, of Tennesseans favor Medicaid. National polling at 76%, and it's going up, by the way. The more it's under attack, the more people realize that, the more they value the program. The problem is, again, this was pushed through in the dark of night on a rocket docket and people are not aware. That's our task, is to raise the awareness. So it's not just sending letters to the senators, but please, please, please write letters to the editor of your local paper talking about this. We've got to raise the awareness.
And this is a question for both of you. We have someone who's kind of looking at the big, beautiful bill structure and saying, there are Medicaid and SNAP issues, but there's so many other issues as well. What is the benefit or the strategy behind mentioning issues beyond Medicaid and SNAP when we contact our representatives? Are we muddying the waters, or do we want to lump them all in? For example, some of the changes that might cause some judge silencing, and maybe, some concerns around the balance of power between the branches of government.
I mean, I think I would articulate any reason that's compelling to you as to why you're against it. I mean, you want to convey to our representatives, and usually it'll be through their staffs, but that you feel strongly about this. And you feel strongly enough about it that you may remember how they vote when you go to the ballot box at some point in the future. So if they think that you feel strongly about it because of judge silencing or for some other reason, that's fine. I just be sure to mention Medicaid and SNAP, because if the compromises get made, then those are the ones that we want to try to hang on to. It's all important, but those are the ones where lives literally are in the balance.
I agree with that. And I think any stories that you have, either your personal stories, stories from clients, or people that would be directly impacted, those make a real difference.
We have a
And we'd
question.
love to hear your story. If you have a story about these programs, please let us know. TJC, we get a lot of requests from the national groups because we have the relationships that we do with folks like you and with the thousands of clients that we serve each year. We have a lot of stories about how these policies play out on the ground. And so, for example, I'll be talking to an outlet, an ABC outlet, right after I get off this call. And that's because of the stories. So please share your stories. We know that stories help people transcend the tribal barriers between political affiliations, religious differences, you name it. We can relate to human stories. And so if you have one, please share it with us. We will guard your privacy, only use it to the extent that you authorize us to use it, but it can really make a difference.
We have a question from Ann Lucas asking if we know how the bill will affect veterans. If it's another.
I don't know what it does specifically to veteran targeted programs, but keep in mind that there are millions of veterans and their family members on Medicaid and receiving SNAP. In fact, it's a scandal, but there are active duty military whose incomes are low enough that they depend upon SNAP. So it's important to remind elected officials who are always thanking veterans for their service that if you really appreciate those folks and their families, then you won't do what you're thinking about doing here.
And one thing that I would add to that, during this last round of reconciliation, there was a provision put in there to particularly waive work requirements for veterans, which was something that was good that came out of last year's reconciliation. There was debate, however, during this round about removing that provision. So that's not off the table. Veterans will be impacted. A few years back, it was estimated that we have over 54,000 veterans in Tennessee who participate in the SNAP program. And so it's very important that no SNAP cuts happen, because it will have an impact on veterans, and they are debating whether to keep that waiver in place. So something to keep in mind.
Insignia, is that 54,000 veterans by themselves? Does that mean 54,000 veterans and the households?
Households,
Their
yeah,
households.
yeah.
So, and the average household size is what? 2.5 people, 3
Mhm,
people?
mhm.
So veterans care about their families. So if you care about veterans, you know, like, don't just exempt them. Think of what you're doing to those that they love and who are dependent upon them.
Great. I have someone asked a question in the chat that I just responded to, but I'm just going to vocalize to everyone. We have a question asking, do we know how many Tennesseans rely on SNAP? And have we heard directly from people deeply concerned about these cuts and how it will impact their quality of life? The answer is yes. We know that there are about 750,000 Tennesseans who rely on SNAP annually. That data is reported by DHS and national groups, so we know that that's pretty consistent over years. And we are hearing from those who are worried about the SNAP cuts because they rely on SNAP. As Gordon and Signy have emphasized, stories are key right now, so we actually have a process for collecting their stories, their narratives in their own words and compiling them as part of our advocacy. So if you'd like to discuss more how we're approaching the story collection process on the Medicaid and SNAP side, I put my email in the chat. You can reach out to me directly and we can talk more about that. But thank you for that question. Yes, we know that there are quite a few people, almost 1 million people in Tennessee relying on SNAP.
And one thing that I would add to that is in the House bill, they are looking to impact the benefit amount. So right now, families get about $6 a day to be on with SNAP benefits to be able to afford food. $6 a day does not get you very much. And so in the House bill, it would make that benefit amount stagnant. And that will have an impact on everybody who participates in SNAP because they will not be able to rely on the scientific input and information about cost and nutrition factors that play into why a benefit amount should be increased. And so the bill would really hamstring families and not provide the amount that's needed in order to be able to put food on the table.
It would just drive more families to the cheap, readily available processed foods that feed the obesity
Right.
epidemic,
Right.
with all of the costs that come
Yes.
with that in terms of people's health and children's long-term life trajectories.
Yeah.
Did you mention the food banks?
Yeah, I did not,
Okay.
but yes, at the same time that these cuts are being proposed to SNAP, there are also major cuts being put in place to limit food banks being able to provide emergency food. So the idea is that these programs work together, right? SNAP is very important and feeds many more people than one meal funded to a food bank. And so the idea is we need both. We need SNAP to be supported as well as our food banks. If you're cutting both, what are families supposed to do? And so at the same time, we need to be supporting SNAP. We also need to make sure that Congress is not limiting our food bank friends as well.
I have one more question in the chat, and then I invite folks to raise their hands, come off mute if they have questions. We'd love to hear from you. Gordon, do you remember the graduate medical education funding cuts some time ago? Do we have any idea of any takeaways from that time and how that affected funding for teaching health centers?
I don't know. There are, again, this is all in play still. The funding, the questioner is referring to the fact that teaching facilities which includes not just something like Vanderbilt or UT Medical Center, but other hospitals that have residency programs get funded by Medicaid. Medicaid has funded them and has created important incentives, particularly for primary care in the past. That's part of a whole bundle of state-directed payments. There were efforts in the House to mess with those. They were defeated, but again, that could be reopened in the Senate. And by the way, that's a good example where we mentioned that these cuts affect people not just on the programs, but the larger communities.
Yeah.
So you start messing with graduate medical education, you're affecting the pipeline of tomorrow's doctors.
Yeah, exactly. And that just to vocalize, that was part of the reason behind the question, because we're thinking about what happens to the medical workforce as doctors retire. Do we have the provider population that different communities need to remain healthy? So that's really important. Thank you. Thanks to everyone for these questions. I'm going to just vocalize something that John Klontz put in the chat. 750,000 people on SNAP is close to 10% of the state population. So we're talking about a really, really significant chunk here. So just kind of keep that in mind when we talk about the potential devastation if these programs are cut, if the state can't afford to administer SNAP, and if we're having a crisis of food access at the grocery store and at food banks. So just wanted to add.
One thing that I wanted to add to that too is this SNAP program is one of the best and most effective anti-hunger programs that we have in the country. And it works when we are going through economic downturns, when there's high unemployment. And we've seen that number get even higher than the current 750,000. So the idea is when families are having a hard time making ends meet, they're supposed to be able to access the SNAP program. But with all the cuts that are proposed here, it makes it really hard for us to set up a program that supports families when times get tough.
Sandy, what percent of the 750,000 Tennesseans that rely on TennCare, what percent of those, the only income into their household is their SNAP benefit?
So just to give you a perspective,
As I recall, it's something on the order of 20 to 25%.
Yeah, no, it's very low. Around
that's a lot of people. You
Right.
mess with SNAP, to think that's all that
Exactly.
they have coming in a month.
Yeah,
That is desperately poor.
yes.
Yeah.
That is extremely poor.
Around 50 to 60% of households who participate in SNAP in Tennessee are households with families. Around 33% are families that have seniors or an individual with a disability. And around that same percent, around 33% are working poor, who are working and have an income, but it's not enough. We see families who have 2 jobs, 3 jobs sometimes, and still are eligible for the SNAP program. So when we dig into the work requirements and who's on SNAP, there's a lot of misinformation about what's going on. Just to Gordon's earlier point, people who can work are working. Many of the families that are individuals who are held to these work requirements, sometimes they don't have the hours in the required hours in the week, and oftentimes that's not their fault. It's their employer doesn't have the hours for them, or for whatever reason, it's just not the way that the picture is painted, right?
Yes.
Like individuals are trying their hardest, and so the program should work to help those folks.
Yeah.
Not trying hard enough to satisfy Elon Musk.
Sadly, yeah.
Someone's asking, can you clarify when changes to SNAP and Medicaid will come into effect? There are a couple of different effective dates mentioned, 2026 and 2028. So what do we know right now in terms
Short
of
answer is no, we can't.
No, we can't. Okay.
But since I'm a lawyer, I'm not going to just settle for a short answer. But I will rattle on for a minute. There are two reasons why we can't give an answer to that. One, we're still deciphering the bill. Two, it's up for continued modification in the Senate. And as we saw at the last minute with the revisions that were made in the middle of the night in the House, what had been a 2029 deadline for the effective date of the work requirements got moved up to the month after the midterms, December 2026. So it's just in flux. And I think the general trend will be in the Senate to be more aggressive about making these bad things effective earlier because they want to capture the savings to offset the tax breaks. So that's what we saw at the last minute in the House. That's likely to be the trend in the Senate. Now, that's not all bad. If they make it even meaner, even more oppressive in the Senate, it could make it difficult for them to get it back through the House where they only had a one vote version. So if they don't pass the same bill in the Senate, it's got to be reconciled with what is in the House. It would go to a conference committee to work out the differences, and that may make it difficult for the House members in swing districts that have a majority Democratic voters. It may be difficult for them to vote for it if it gets any worse than it already is. So it's hard to know who to cheer for in here. Sometimes our allies could end up inadvertently being those who are calling to make the effective dates earlier, to make the cuts deeper, to make the rules more repressive.
Okay, anything to add to me on that point?
Yeah, I echo what Gordon said. For SNAP, just from the last reconciliation bill, the work requirement provisions went into effect pretty quickly. So things like that would happen sooner. The cost share in the House bill was originally mapped out as 2028, but as Gordon said, they're still finalizing all of that information, and so as soon as we have the solid detail, we'll share that out.
Yeah.
And we may not know that until just before the Senate vote, because the House had what they call markup, public committee hearings where the provisions were debated. The Senate is gone dark. They're going to be doing this without markup, and there are 3 different committees that are involved. And we probably won't know until the last minute. Keep in mind that there are 400 and something members in the House. There are only 100 in the Senate. 53 of those are Republican. And so it's a small group that's working behind closed doors. And we just won't know probably the details until they spring it out to vote on the floor. Their big strengths are speed and secrecy. Our countermeasures are to slow it down so that people are aware of what's happening and to shout from the rooftops, this will be terrible for millions and millions and millions of Americans.
Okay, so we're almost at time and there aren't any other questions in the chat. If you have a question, drop it in. We have a couple more minutes. I just wanted to reiterate, what we know right now is that a floor vote is anticipated June 23rd. So
that
that's
week, sometime in that week.
That week. So that's our timeline for advocacy. So we'll have a couple of more of these Wednesday meetings before then, to give you what we hope will be new information. But please stay engaged, stay active. Like Sydney said, if you have the stamina, dig in. Now is the time.
Not if you have the stamina.
No,
You
find
must have the stamina.
find the
If
stamina.
you don't have it, get it from somebody else.
Right. Yeah, because the next couple of weeks are once again really crucial. So
And speaking of getting it from somebody else, I know that many of you have already called, you've already asked for visits. Please reach out and spread the word and get other, if it's folks in your Sunday school, if it's folks in your PTA, your kids' PTA, if it's your neighbors, whoever it is, please reach out and just, you know, assign yourself a task, one person a day. I'm gonna reach out to one person a day that I haven't already put the finger to say, please, act on this. Is why it's important. Or if you are more technically savvy than I am, which everybody on this call has to be, hopefully, you know, sit at your computer or your phone and send out emails, forward our emails, get people to sign up to follow the news with us.
Are you all able to hear me?
Yeah, we got a thumbs up.
Okay, great. I got a message that the volume was low, so I'll try to speak up a little bit. Okay, I think we're back. We're back. Thanks, everybody. Okay, so yeah, Gordon was just giving us all the encouragement we need to push through the next couple of weeks. Saying that if you've already done this, do it again, but also find someone, pull them into the fight, get them engaged, give them this information. Medicaid and SNAP are not, they're part of all of our communities. There are people in need across Tennessee who rely on these programs. So it's really crucial that we're all a part of the conversation and we're all a part of the advocacy. We'll share out opportunities for action, whether they're coordinated by us at TJC or by national groups, and give you all a chance to, like I said before, get involved. As always, if you have any thoughts or questions regarding anything we've discussed on the Protect Medicaid and SNAP front, please do reach out to us, and we will gladly disseminate that information. Thank you, everybody, for joining us. We'll stick around for folks who have thoughts or questions. But we're endlessly grateful for your time and tuning into this conversation every week. Thanks, y'all.
Thanks, everyone.